In the Department of Corrections currently, we're facing critical staffing issues related to difficulty hiring and increased retirements and low staffing since we transitioned from Yukon Health Center to Department of Corrections. The low staffing has made it hard for people to do their jobs in a successful way, and it has made it hard for us to give the care to the inmates that we feel we should be giving as providers. It's critical that the inmates receive services that they need while they're incarcerated, because if they don't receive those services while they're incarcerated, they don't return to the community in a healthy way, which then burdens the community and doesn't make it as possible for them to be successful.
When we talk about working short, what that means at any facility, particularly in mine, is nurses are working tremendously long hours every day on a daily basis. We are at risk for getting mandated a lot, which means that when a staff does not come in or if we are short-staffed, we have a tendency that we have to stay. We cannot just, say we are going to go home.
Floating anywhere for any nurse is very dangerous. My home facility is Northern, but when due to the staffing crisis and sick calls, etc., they will float us willy-nilly to different. I may go to Northern and they're like, okay, it's your turn to float, so then I have to drive over to another facility, which is all its own little world. Everything is different in each facility. Everything is kept different in each facility. We kind of know our inmates in Northern because, that's our home place. So we're given a whole new, say Carl Robinson, a whole new 1,200 person population that we don't know.
The hidden cost to not making an investment in the Department of Corrections health services is that overtime costs are then inflated. Inmates have worsening health issues, and workers look for other jobs. The hidden cost is high turnover rates, more illnesses and lawsuits from the inmates.
This is just really not acceptable. It's very dangerous. You all are going to pay out millions and millions of dollars in lawsuits because people are going to get deathly sick, and they already have. They already have been so sick. They've died, and we want that to stop. We want it to stop now. We want more nurses and doctors there. The opioid crisis is killing us. It's just killing us. And we have to be safe practitioners. We can't lose our licenses because we're this critically short, and that is what the danger is for nurses and doctors there.
If I were to speak to a legislative official today, my main advocation would be to definitely increase funding for our DOC budget, particularly because we are severely short, we are understaffed, we are concerned about quality inmate care, something that we went to school for to be able to provide, just like a regular hospital. For one, I take pride in what I do. I enjoy what I do. I could not imagine myself doing anything else. I'm working with the inmate population, and I know that's a difficult thing for some people in the community to hear, but it does make me feel like I make a difference when somebody comes in really sick and then they were to be released in the community, being well treated, being the way that we expect our brother or neighbor or friend to be released in one piece.
The staffing crisis is really hurting everybody. The staffing crisis isn't just hurting the inmates. It's not just hurting the staff in the facilities. It's also hurting society. When we can't provide services because we don't have enough funding to provide the services that we feel we should be providing as providers, the reality is everybody suffers. The workers suffer because they feel downtrodden that they can't give the services they took oaths to give. The inmates are frustrated that they're not getting what they feel they need. And it really is the responsibility of everybody to take care of the incarcerated population. Without that funding, it's a daily struggle to do that work.
Fund DOC Health Services.